Hi, and welcome to the How to Use eRIC video for nurses. The purpose of this video is to assist you in understanding how to navigate and document in eRIC whilst looking after a patient within the ICU. Please refer to the local eRIC guides made available to you by your ICU educator or team leader. You will also need to confirm what documentation remains on paper and what documentation is to be on eRIC. Let's get started. The round eRIC symbol is the live environment. This is a symbol you need to double-click on in order to log into eRIC and document or view information regarding your patient. Once you double-click on the icon, it will direct you to the main blue IMDsoft MetaVision login screen. To log in, please have your StaffLink username and password ready. Then select your department. This refers to the ICU site you are working in. Click Log In. If you do not have access to eRIC or are having issues logging in, please notify your team leader for assistance. When you successfully log into eRIC for the first time, a pop-up window will appear. This states that your username was successfully created in eRIC. Click OK to continue. The screen will disappear briefly. Please be patient. Within seconds, it will redirect you to the eRIC work list. When you log in for the first time, your list will appear empty. This is because you are in My List view. To view all current patients in the ICU, click on My List. Select Change Patient Set, New South Wales, Pre-Admit, and Admitted Only. This is called the Work List. You will now see all pre-admitted and admitted patients within your ICU department. To access a patient's file, simply double-click on their name. This will now take you to the patient's main screen, known as the Clinical Overview tab. Please note, before entering any data into the patient's file, you must ensure you have the correct patient and confirm that it is you that is logged into the system. Once in a patient's file, familiarize yourself with the components of the main screen. This is known as the Clinical Overview tab. The title bar located at the top of the screen displays the patient's details. This is similar to a patient's white sticky label, but with additional information. The status bar is located at the bottom of the screen. It displays the active user currently logged on, ICU department, patient status, and any participating research studies that the patient may be on. This also displays a message center. This flashes red when a certain dose or task-related action needs to be validated. This will be explored in more detail throughout the video. The menu bar is composed of mostly sub-menu buttons. Some submenus will open additional submenus, where others may open up particular forms or windows, such as a dose and task list. As a nurse, majority of your documentation will take place within the purple and orange tabs. Additional documentation and review can also take place in titrate medications, pathology, nursing menu, dose and task list, and add progress notes. This will be explored in more detail throughout the video. Beneath your colored tabs is the time bar. Here, you can see the ICU department, date, and time of the page you are currently viewing. Time moves from left to right and defaults to 1 hour. This can be seen here to the right of the screen. This is where you can change the time increments that are displayed. To the top left of the screen are your scroll buttons. Double arrow back and forward will move your view a full page. Single arrow back and forward will move it forward or back a column. The crescent moon takes you back to current date and time if you get confused as to what time frame you were viewing on any page. Or to default back to the main page and current date and time, click Refresh or press F5 on your keyboard. Since this demonstration is within the training environment, there is no live data displayed at the current date or time. It is important to note that the validating of data must be attended to within the vital signs or ventilation tabs to avoid missing any information that could be documented. When in the live environment, this is what unvalidated data or device data that is yet to be confirmed looks like. Data that has been manually entered or device data that has been confirmed as correct is identified here in bold. To validate data, single right-click and drag on the cells you wish to validate and select Validate. The data will change from non-bold to bold, indicating human-validated data. This action can also be attended to for mark error, warning, or when adding comments. In this example, mark error is identified with a strike through the cell. This is used if data collected is not correct or deemed to be true by the nurse or clinician. If you have accidentally validated data, simply correct it by typing over it, then press Enter when done. Warning is identified with red font. This is used if you need to bring attention to an abnormal value or a particular cell. Comments are identified by a green triangle to the top right corner of a cell. This is used if a nurse or clinician has inserted additional information. To minimize or maximize the tabular view, single left-click on the up or down arrows. To see more of a tabular view, click and drag these grey bars. When receiving or providing handover for a patient in the ICU, it is important to document and sign off in the nursing management plan. This can be found in the nursing menu. This is to confirm that you have received and/or provided the most up-to-date handover of your patient upon changeover of shift. Once you have confirmed the patient's ID band and filled in the relevant details, select Save and Close. At the beginning of every shift after reviewing your patient and the room, please complete the safety checklist found in the nursing menu. Fill in all details and select Save and Close when complete. This is where you can view and document all observations regarding your patient. Highlighted in yellow are the vitals that should be attended to regularly. According to your ICU's workflow, validate or document hourly the heart rate, cardiac rhythms, systolic blood pressure, diastolic blood pressure, and mean blood pressure. Document temperature and temperature source every 1 to 4 hours according to your ICU workflow. And document blood glucose levels and arterial blood gases as required. Any data that is not populated from eRIC must be entered manually. Document all ventilation observations in the Ventilation tab. All ventilation observations require hourly SpO2, airway type, and FiO2. For invasively ventilated patients, all ventilator observations including mode, humidification type, temperature, and water check must be done hourly. ETT and tracheostomy observations including cuff pressure, position, and size must be attended to 6 hourly. For non-invasively ventilated patients, ventilator observations, humidification type, temperature, and water check must be attended to hourly. Document all neurological and pain-related observations within the Neuropain tab. Documentation needs to be attended to 4th hourly for the following: complete GCS checks, pupil size and limbs, strength, pain score, and sedation paralysis. Data will only populate in the neurological view once the form has been completed. To view other available neurological observations, show the hidden rows via the cogwheel. Other relevant forms are available in the bottom tabular view of this tab. All input-output related data is recorded and documented within the Input-Output tab. All continuous infusions signed for in eRIC will automatically populate into this tab. Any fluid given orally or prescribed on paper must be manually entered to the corresponding times. Any urine, other bodily fluids, or drain output must be entered manually. Once documented, lines, drains, tubes will appear in the bottom view. All areas that require manual input are highlighted here in yellow. When a line, drain, or tube is inserted for a patient, it must be documented on eRIC. To document, go to Nursing, Input-Output Devices and Observations, and select the appropriate line, drain, or tube. An order entry window will appear. Ensure the correct date and time is applied against the line, drain, or tube. Some windows have a mandatory form attached. These forms at the bottom left-hand corner indicate a mandatory form that must be completed. Document the appropriate mandatory fields. Once complete, select Initiate. The line, drain, or tube you have just entered will now appear in the Input-Output tab in the bottom view. To add a progress note, go to Add Progress Notes within the menu bar and select Nursing Notes, ICU, and select the desired progress note entry. When writing any notes within a patient's file, you must check that it is for the right patient, that it is the correct date and time, that it is a new session, and the user logged in is you. Please note, never open another person's progress note and add to it. Always open a new session. Once you have completed your progress note, select Save and Close to save and close your session. Your progress note will now be found within the Progress Notes tab. To read a progress note entry in the Progress Notes tab, right-click on the progress note you wish to read. Select View. This enables you to view a progress note without the possibility of saving over another person's progress note entry. There are two ways you can sign off on a medication administration. Both will lead you to the dose and task list. The dose and task list within the menu bar, the Message Center in the bottom left-hand corner in the Clinical Overview tab. Once you are on the dose and task list, you may see red, green, and blue orders. Red refers to a late order, green refers to an immediate order, and blue refers to a future order. This also applies to all PRN orders. PRN orders are located at the bottom of the dose and task list. There have been no PRN orders charted for this patient. To sign off on an order, tick the small box to the left of the order. Click on Validate to open the order entry window. This will open up an order entry window. Once here, perform the 5 rights of administration: right patient, right drug, right route, right time, right dose. For infusions, document the starting rate of infusion. Have an RN co-sign the dose order if required by entering the StaffLink username and password. Once complete, validate and close. You will now see your signed medication order in the Medication Plan and Titrate Medications tab. To sign for oral medications, follow the same steps from the dose and task list. Perform your 5 rights. If a cosign is not required, click Validate and close. You will now see your signed medication order in the Medication Plan and Titrate Medications tab. This tab allows you to change the dose rate, bolus, stop, or pause on a running infusion. To titrate a running infusion, right-click on the green line of the current running dose. Enter the correct time that was actioned. Select the desired titration action. In this example, we will bolus the infusion. Enter details as required. Ensure the date and time is correct. Select Validate and close. You will now see the bolus symbol on the running infusion. Please note the following information. Any actions of titration attended to must be done in chronological order. Mark in error applies to the entire infusion and not the action selected. If you have documented an action in error, please request assistance from your team leader. If you use a mark in error action, the entire infusion selected will be deleted. Do not use mark in error for infusions. Only document an infusion as stopped if the order has been discontinued or a bag change is attended to. If a verbal order has been given to stop an infusion, pause the infusion until the order has been discontinued. Featured here are the titrate medication legends. Please become familiar with these legends. Ensure the removal of all relevant lines, drains, and tubes are documented in eRIC. To do so, go to the Input-Output tab. Right-click on the green bar corresponding to the lines, drains, or tubes. Select Stop. Then specify the date and time it was removed. You will now see a red square that indicates a line, drain, or tube has been removed. Please note, communicate with the medical officer in charge of your patient's discharge to cease and review any medications not required on the ward. Once it has been confirmed that your patient is ready for discharge, a nursing discharge summary must be attended to. To do so, click on Nursing in the menu bar and select Nursing Discharge Summary. Complete all 3 tabs within the Nursing Discharge Summary. Use the grey scroll bar on the right-hand side of the form to ensure you do not miss any areas of documentation. Remember to attend to a full set of observations prior to discharge. Once completed, select Finalize Nursing Discharge Summary, then click Save and Close. A pop-up window will ask if you would like to generate the eHOC. If you select Yes, it will be generated and ready to publish to your hospital's electronic medical record. If you are certain the medical discharge summary has been completed, select Yes. If not, select No. To check if the medical discharge summary has been attended to, click on Medical in the menu bar. Select Medical Discharge Summary. Go to the last tab, labeled Interventions and Events, and check the Finalize Medical Discharge Summary. If this box has not been ticked, notify the medical officer attending to your patient's discharge. If both the nursing and medical discharge summaries have been ticked as finalized, generate the eHOC. To generate the eHOC, go to Nursing and select eHOC. This will open the eHOC in an internet browser with a question. Publishing a report queues this eHOC report for sending to your EMR. Do you wish to proceed? Select Confirm. In addition to this, confirm with your team leader if a printout of the eHOC is required. The eHOC will now be found in the patient's file within the electronic medical record. Please also ask your team leader if you are not sure of where to locate the eHOC in EMR or CAP. Please confirm with your team leader regarding who is responsible for releasing your patient from eRIC. When your patient is ready for discharge, please consult with your team leader. Please note, upon your return to the ICU post-discharge transfer, you must stop all lines, drains, and tubes that were in situ on your patient, stop all scheduled tasks, notify medical officers to discontinue any medications or continuous infusions, and releasing the patient from eRIC makes a bed available for the next admission. For further information regarding eRIC or workflows, contact the team leader or access nurse on shift. Thank you.